This episode is brought to you by Chrome OS. Imagine a healthcare system where technology works seamlessly in the background, keeping your data secure, your teams connected, and your patients at the center of care. Chrome OS customers report higher productivity, lower operational costs, and a reduction in security attacks. Leading health systems have lowered EHR login times by implementing Chrome OS with Improvata single sign-on. Chrome OS and Chrome Enterprise browsers help you deliver secure, seamless experiences for your care teams, from mobile clinicians to shared workstations. Learn more at thisweekhealth.com/Google-Chrome OS.
Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview.
Hey everyone, we're here at Vive 2025. I'm in Nashville and I'm with Sebastian from Google. How's it going?
It's going great, Drex.
Yeah?
Thanks, yeah.
How's the show been so far? What's been interesting? Have you seen anything cool?
Yeah, it's been great speaking to customers about what they're doing to improve the clinician experience, but we're now on the second day and we've had some great engagement yesterday.
Yeah,
So,
awesome.
enjoy it.
Obviously, I want to ask you about Google and all the stuff that you're doing. Just tell me a little bit about your background and the Google story and where you're at now with all the healthcare work that you're doing.
Yeah, absolutely. I've been working with healthcare organizations for 15 years personally across a few different organizations. Been at Google for a year and a half, and I was brought on to help scale our healthcare business, particularly in Chrome, both the operating system and the browser. And what we're doing on our end is really working to help modernize the endpoint experience for clinicians and how they access the information, because that's where the point of care happens. It's extremely important for that to be a seamless, transparent experience for the frontline workers that do the important work out there.
Yeah, two different parts, the operating system, the browser. Tell me about the operating system business and the problem you solve for healthcare from the OS perspective.
Yeah, really up until just a few years ago, there's been a standard in the enterprise and in healthcare of there's one operating system that really dominated things. And it wasn't until a few years ago where Google has had Chrome OS out for 14 years. We've done really well in education, and there's a great value proposition of this operating system that's been built in the era of the web. It's a more modern operating system built from the ground up to be secure. So now we've done a lot of work with our partners to integrate those things that you see in healthcare systems. Today, it's a viable option for healthcare systems to look at Chrome operating system because of the integrations we've had with, for example, we have a great partner, Ricoh, that makes Fujitsu Ricoh scanners that you see pretty much everywhere, right? Those things are now integrated, but the problem we're really solving for is organizations are looking for an alternative to drive down costs and increase security, and that's really our value proposition in healthcare are those two things.
A huge amount of cost pressure, and the experience that you have with higher education and education in general with the operating system has been super impressive. I'm sure laid a lot of groundwork for those folks who are now transitioning into the workforce too. Security and the browser. So as we talk about all this stuff, for me, but I think for healthcare in general, security is top of mind. So what's going on with the browser? I know that's not a new business for Google, but it's a new business for you to start working on.
Yeah, so on the browser side, Chrome browser is used by many people.
Yeah.
It's a very popular browser, secure as is as a consumer. What we've done is really taken some technology that help wrap and secure the browser for an enterprise organization like healthcare to be able to lock down and create policies around it for making sure there's no patient data leakage, blocking certain websites, contextual access for work from home folks and coming into the office. So really we've done a lot to wrap the browser that people already know how to use and love that are already living on endpoints in these organizations. Chrome's already on every endpoint, most likely. So it's just a way to enroll and bring into management to enforce policies without really having to train users or deploy something, right? It's just taking control of it.
So they're already using Chrome browser, but they're just using the commercial version of Chrome browser, which has from time to time some stuff that happens from a security perspective. It needs updates and that kind of stuff. The enterprise version of that is just easier for them to manage or run. It's custom to them. How does it work?
Yeah, great question. So it's able to bring the browser into management so you can force and ensure that they are getting the updates. It also allows to block certain extensions, to block certain websites, to ensure that certain sensitive data cannot be copied and pasted or screenshotted, watermarking, right, for certain things.
So tell me about watermarking. How's that work?
Yeah, the watermarking piece is it'll watermark a certain site that maybe you don't want folks to. It's just a visual reminder of I probably shouldn't be screenshotting or sharing this.
I see.
So there's, again, different levels of control depending on the organization, how they want to set things up. But it all resides, again, in the same browser that they're using. It doesn't require any client installs or plugins. It's just within the same browser that your users are using.
The security part of it, like I said, is super important. Besides the cutting and the pasting and not being able to go to particular sites, are there other capabilities in the browser? I'm thinking about it from the perspective of a lot of the stuff we do today is software as a service.
Yeah.
And so I don't have that stuff on my on-prem anyway. And sometimes even if I do, my access is still through a browser.
Yeah.
How does it make the security for that better with BYOD devices and folks that are coming in, contractors that I hire from the outside, all those kinds of things?
So with browser, obviously there's a lot of folks that today, potentially contractors that are coming in, folks that are working from home with BYOD devices. It gives organizations an option to simplify and eliminate the need to necessarily give them devices or to grant them access to a VPN or to grant them access to maybe give them a virtual desktop.
Or I don't have to try to secure their device. Like I see organizations trying to do that too, and that can be a nightmare.
So you're with the browser able to basically encapsulate your corporate data and keep it all within that browser and have control without, again, having to install anything on that person's device. So it's great for those BYOD and contractor use cases.
Yeah, love that. Where do you think we're going in the future with all this stuff? Is more SaaS? What's the future for Google and healthcare?
The future and the trend we're seeing is more and more customers are moving to the web, right? And with that, vendors are doing a lot of work to get more to the web. So you're seeing a lot more web EHRs. You're seeing a lot of innovation happen there to move away from the kind of legacy client installed applications. So with that, I think Google and Chrome are really well positioned, right? We create the code base for Chromium to be a great partner, not only to partners, like all these ISV vendors, but also to our customers in helping with that journey, right? To go more to the web. Really where we see things going is the browser is going to be the number one application. With that, there's not really a need for a very complicated and robust, right? We have a streamlined, simple to use, secure operating system like Chrome OS to empower that. But also with the browser, you have choice, both devices. So that's really where we see things going, is going more towards the web. And with that, again, organizations will have more flexibility with what they use from a technology perspective.
Love it. Let me ask you about the mobile device, because we're all carrying phones, we're all carrying tablets. How does it work with mobile devices?
Great question. The browser piece, everything I spoke about around securing a browser will work on a mobile device, and there's a lot of work being done there from the teams. And then we also have our Android partner, and there's a lot of work they do of Android for Work, and our EMM partners on that side to manage Androids. We also cover that as well and help secure those devices. And just something to think about as far as this year goes, and what I'm hearing a lot this year from customers is there is this compelling event coming up that many organizations have not fully figured out yet, and that's the Windows 10 end of life. I just want to call out the fact that with Windows 10 end of life, there is the ability to repurpose your devices that you already have in your fleet to become Chrome OS devices.
I love that.
Rather than go buy a new PC, you could repurpose, save money, again, drawing down costs, and then we, again, integrate with all the things that you have in place today.
I love that. I love that. Hey, thanks for spending time with us today. I really appreciate it.
Thank you, Travis.
Okay.
Yeah,
See ya.
Thanks for listening to this Interview in Action episode. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. Thanks for listening. That's all for now.